welcome to Planetary Health First, Mars Next. My name is Michael Mann. I'm the host, founder, producer, dishwasher, and everything else. We have Joia Nunez here today, and she is here for a specific reason. We are really empowered here on the show locally. That's mean like try to be better as a person first yourself, try to be better as a neighbor, which sometimes isn't easy. We have a weird phenomenon in the US now where you just don't know your neighbors. I guess that's why I love pickleball so much, because it's such a amazing sport and activity where you get to experience 12 to 90-year-olds and male and female equally as a social unit and group on the court, and you get some exercise and some competition. But here we have a global warrior, who came from Argentina, is now in Spain, but really probably doing much of her work empowering the company she's at today, Adhera Health. Would you like to just introduce yourself real quick before we get talking too much?
Yeah, of course. Thank you very much for inviting me to your show. My name is Joia Nunez, actually, but that's the funny N we have in Spanish. And I'm originally from Argentina. I'm a medical doctor specialized in pediatrics, but for 5 years now, I've moved path. I changed career paths and moved into health informatics. And it's been a year since I relocated to Madrid, Spain. And as Michael was saying, it was a challenging decision to live abroad and pursue that developing opportunity.
Awesome. Well, I am sort of selfishly fascinated to have Joia on, not just because she's a joy, and I'm sure that's where that name is coming from. And it's great to be not only a clinician in healthcare, but wouldn't you want your healthcare doctor to be a joy, right? I mean, just to bring you joy, health, healing. But I hope one day to be in Spain, and that's because of my situation. My wife speaks Spanish, and we're going to be empty nesters soon, and we might even bring our daughter with us. We would like to be, a global culture. We think we're better people if we know people across the world, and so that was one fascination that I had with Joia. Not only that she's Argentinian, decided to go to Madrid. Can you just share with us about what that experience, like the papers, the nightmares, whether you could get the visa, how to do that? I think there's so many people out here, not that I have gazillions of audience. I mean, it's, building an audience is not for the faint of heart, but I try to handpick, select people and topics that I think are really helpful and meaningful to people. And I think this is a good one.
Well, for me, it's been a very long process because since I first got the idea of moving from Argentina to Spain or Europe, it's been 10 years mostly. And well, the decision began when I was still in school, medical school. So I realized very early on that I would have to do a lot of paperwork to convalidate my degree and to, well, get a visa and obtain a permit and everything. So I started doing all the research and the paperwork that was required for me to be able to move. And Spain had some advantages from people from Latin America, such as, well, the language, as you mentioned, but also there's some like agreements between the countries that allow certain convalidation or certain degrees to be applicable between two countries. It was a very hard process and a lot of paperwork needed to be done. And in the meantime, my husband realized that he had Italian heritage. So he applied for his Italian citizenship and he got it. But that was also a very long process. It took him like 5 years to finally obtain the citizenship. So after all these uh, these processes that were individual but ongoing for a long time, we last year we were able to take the leap and come here. And in the meantime, well, at first I specialized as a pediatrician, and that's another specialty that I'm still trying to convalidate here. But um, but in the meantime, I decided to specialize as well in informatics, in health informatics. So that allowed me to work remotely, have a different quality of life, work-life balance, and it gave me a lot of new opportunities, and also it set like a new scenario for me to practice health, but also pediatrics, but also informatics. So it's kind of like that moment right now.
Cool, cool. And curious, I just heard a few weeks ago from a buddy of mine, I guess getting into that retiree space. I don't know if there was an interest with you and your husband. Not only what did he find out that he had some heritage, Italian heritage, and I guess they recognize that for getting your citizenship. I don't know if it's dual citizenship that's applicable. I know some countries have that status, but someone, the gentleman was telling me, as long as you're south of Rome. Now, I don't know that exact line, but in the United States, as much as we love our country, I think it's universal. Most people like to keep more money than give to the government, than give to Caesar. No pun intended. No pun intended. But you know, there is also, unfortunately, the environment in America. We don't feel like when we give our taxes that we necessarily always. I don't want to get too political, but needless to say, the short answer is if it's south and you go to Italy, it sounds like there's a flat tax of 7%. And that makes it very advantageous and interesting to Americans. So, was there any consideration in that as a factor?
No, not really.
Okay.
We just embraced what we could at the moment, and we weren't even entirely decided that Madrid was going to be our final and definite location. It was just like an entry point, and then look for whatever opportunities that might arise. And well, you were talking earlier about the digital nomads, and that's also an experience that we might want to pursue at some point. So we need to have a financial location for taxes. And so in this process, we were moving from Argentina, and now we are in Spain. So that's what we did, but we didn't look for um, any other strategies on
Okay.
that field. Yeah.
No, okay, all right. Well, I think it was also interesting. There's different countries, maybe Spain as well, and Italy. I think they really are doing, and I think most of this globally. And correct any of the audience, yourself, any of the viewers. Every time we do this, we try to do a newsletter. We would love for you to chime in, or if we need to do corrections. But what it appears, at least in America, there's about a 1.7 birth rate. And you probably know this a little bit as a physician, clinician, some of these data points. But we have most of these industrialized nations declining population, as well as Italy and others, I imagine, other than India and Africa. And I'm generalizing, forgive me, right? And you see these interesting things like in China now they're increasing, trying to do this because, you know, with us in America, and I'm sure it's generally as well as others that there's tax base, all these different things. So it looks and it appears that a lot of these countries are encouraging expats for tax bases, all these sort of things. So they're doing some interesting things. So I think that is a very fascinating ecosystem that's making it attractive to wherever. Even there might even be some of that going on in South America, where in Argentina, I don't know, but I know like different countries have that as well. Whether I think Costa Rica, there seems to be a lot of expats as well. But for the focus of this show, I would love for you to share a little bit about, now that you're working, you're working at Hera Health. Tell us a little bit about how that is just on a day-to-day basis, what that looks like too.
Well, my job at Ira Health is actually kind of a combination of different positions, because I'm doing digital health research, but also I'm improving and developing product. So being the pediatrician of the company, and the company offers a digital product for children with chronic diseases, but with a family approach. So it's not only oriented for the patient, but also for the entire family. My job is to provide some clinical insights for research, but also apply all the knowledge and feedback that we get from patients and families into the product to make it more appropriate for these families.
And so what is your business model? A subscription? Is it you're flying, doing some grants and research? How do you guys work through your business model?
Well, at this moment, we're a B2B company, so we offer our platform to clinics, hospitals, providers, and payers, and they offer the service to their own patients and also clinicians.
Yeah.
So at one point, probably we will also offer a B2C kind of model, in which whichever patient has the need or the desire to acquire this program would be able to do it, no matter what provider they have.
Cool. How'd you find out about the company?
Actually, I found out about the company through LinkedIn. I'm very active in that social platform, and I guess we had some people in common from the company, and I actually reached out to one of the founders without having an open position for what I'm doing, but we got to talking, and I told him my background, my experience, and the value I thought I could add to the company. And then we had many meetings with the rest of the board and the rest of the C-level people from the company. And we found a position that could apply, and we worked it out.
That's awesome. I think that's such a good story for people looking for jobs. It's the real frustration is, you got to dig deep. And I think a lot of these jobs, and I know for myself, you're sharing the same thing that I've done many years for the last, at the very few jobs I've applied for. It's by that network, that informal asking, seeking, finding, looking, and developing the right fit. So I think that's really good wisdom for others. Where are they headquartered?
And the company is now based in California, and we have business and ongoing projects both in Spain and United States.
And do you guys, does Adhera have do they have any customers or clinics that are working or helping with Spanish speaking? I know that's there's a good percentage across the United States, but not necessarily companies target that. Is there a strong population of clients B2B that they're working with to solve that challenge?
Well, yeah, we have a very inclusive approach from families with diverse backgrounds. So we take that into account very seriously, and we try to aim for a very heterogeneous population. So that's something that we aim to do, and we keep working to improve each day.
So does Adhera Health, are they do chronic disease? Is it across all ages, or so you're a pediatrician? Is it I mean I guess the term chronic disease typically is referring to older generations, but I guess I don't, I mean if you're a child or you have a disease that's not curable, then would you be categorized as having a chronic disease?
Well, yeah, the diseases can be chronic or acute, no matter what age the patient has. It's more like the nature of the disease that determines that. But we focus on pediatric population, but with this family approach, because we also put the focus on the caregivers' health and well-being. When someone has a family member going through a chronic disease, there's usually someone that takes care of that person very strongly, and that can lead to overlook their own health status, and that also ends up being being not useful for the
Yeah,
patient, or
yeah.
being disadvantageous. So that's our main approach, to have like a family centered
Hmm.
mindset. And the diseases that we are actually targeting right now, they're more focused on the pediatric age, but from childhood to teenagers and adolescents. But when that happens, when people go from a pediatric condition and they transition into adulthood, they usually take a little longer to exchange physicians. So we're also looking into that, and our population is not up until 18 or 16, or the usual cut number, and we extend till 21, 23, 24, depending on the disease and the physician uh, availability.
I think what you're bringing up is, as a consumer, it just doesn't make any sense. Like when I mean specialties, like so I'm going to a new specialty, and they're like, well, we only have an OBGYN, and then there was another doctor, but from a patient perspective, I just need something solved. And so I know we have a problem in America with way too many specialists and not enough generalists, and 95% of stuff can be done by generalists. And so it seems like our healthcare system needs to evolve to get this right. And it sounds like you guys are trying to do that, because it's on the back end. It's a product experience. You know, um, so maybe I'm just overgeneralizing, but I would just share with you what you were saying about the caregiver. I know really well, not only as being in healthcare 15 plus years as a social worker, working on all that, and uh, rehab centers, skilled nursing facilities, helping families, helping mainly the older adult population uh, go back into the community. They might have slipped, broke a hip, or whatever it be, have some cardiac event, and they're going to return. But more importantly, through my parents, my mom's 85, my father's 91. He's in hospice. He's been in since the fall, or last year, 2023. And so the burden of the caregiver, my mom's the primary caregiver. She's been doing, so we still even have someone 36 hours a week, 6 hours a day for my father. It's just, he needs total assist, and it's not, I'm sure it's, with you with pediatrics, it's different, but it's all the decision making, same similarities, decision making, all the, burnout is huge, stress, the caregivers. So I commend you guys really digging deep, because our healthcare system just is not focused in the U.S. on getting reimbursed through the caregiver and providing. They don't even really do a good job recognizing the patient. It's so provider payer focused. So I really commend you as a company to really digging deep on that because it's so needed in healthcare because that's an opportunity lost, that caregiver voice. So
Yeah, exactly. Well, being a family caregiver is like a full-time job, and it's very difficult to take time off to take to trust somebody else to do it, and it's well studied and described that the burden that they feel leads to more stress, more angst, poorer health outcomes, and that's what we're dealing with, and that's what we aim to improve.
do you guys, are you working on Joya to try to do any studies, NIH or any studies to help validate some of your, it seems like with the population, you're getting a lot of research, a lot of opportunity to further do other things?
Yeah, exactly. We had an NIH project that uh, helped us validate our tool and our platform, and we have several ongoing projects validating different areas of knowledge that we need to improve. We have some research done on growth hormone deficiency. Now we're working with type 1 diabetes and obesity, and we have new projects coming up on different types of cancer and some other diseases as well.
Cool. What could you share? Just again, you, what I call you as a digital health clinical informaticist nomad. I really, I'm sorry if I'm keep on noodling on this, but I could just imagine there's young careerists, maybe even younger, so there's probably like two cohorts. One group would be like the empty nesters, like well, anyway, I don't want to be an ageist or whatever, but people that are at a different demographic point of life that might have kids and are getting ready to do another segment of life, and then maybe those have just graduated or mid careers, and they're like, I want to get out and go abroad, or be, or even do it throughout the U.S. But what advice could you do or share? I guess there's a two front, it sounds like there's a ton of paperwork you had to do to go from one country to another, sort of that process. And just what advice would you give people, general advice for this that you've done?
Well, for me, specifically being or changing my career from clinical specialty into another one, I found that it took me an extra effort to explain what I do or what I could do or what my field of expertise includes and the value that it can add to a specific position. But I noticed that once that I get that through and out of the way, it became very obvious and very appreciated, and actually uh, people are in demand of that specialty without knowing its title or on putting in into a specific wording. So that was a challenge that I had to go myself, but also I feel like there was like a personal mindset that I had to adopt in moving from one thing to another, whether they were specialties, career paths, or countries. And there's like an approach to uh, experiences that you have to be open to experience different things and to be willing to deal with that, and that helped me a lot to be a yes man kind of person and go do that and try. I mean, there's bound to be a lot of error and lessons learned from that, but also the insights and the amount of learning that I went through in this past 5 years was really tremendous.
Yeah, I like that you said 5 years because I was the first question I was thinking as you were going through it, like the time frame. And so I think
Huh.
people are just not patient enough for processes, right?
Well, as I mentioned earlier, this idea started growing in my mind like 10 years ago. So if if there was something that I needed to be is patient, because there are some times frames that are out of my control. I can't do any I can do anything to make it shorter.
Yeah. So let our audience sort of know about those LinkedIn, sort of that process. As we get your I think we were having Joy was having some you're good with your hearing with your earplugs.
Yeah, it
Okay, cool.
keeps
No,
falling.
it's real time. I tell you, this is real and unscripted. So, Joy, can you give us a little bit? Like, I know you can't detail 10 years journey, but just sort of those LinkedIn messages, that discovery process. Because I think, this is what I love when I hear entrepreneurs that, they like were living out of their car, they are homeless, and it's like, yeah, I was 25 years as a success. I was a success, a 25-year success or whatever I forget the term. I'm butchering it, but the overnight success in 20 over 25 years, basically. So tell us a little bit about that.
Well, for me, it was like a process as well, because I had all these ideas and prejudged prejudgments, or I don't know, preconcepts that I struggled with. Like I was, I don't know, super concerned or worried about making a digital imprint and saying something that, I don't know, I will look back years from now and say, what was I thinking?" and stuff like that. And I felt that that was like, I don't know, I felt ashamed about that, or embarrassed. So I had to deal with my own self emotional process. And at some point I learned that the same way I felt embarrassed, there was a lot of people that wasn't feeling embarrassed and was getting a lot of attention and opportunities for speaking their minds and stating their points of view. And that was also a lesson that I learned, starting to create my own personal uh, statement, like my point of view, my having opinions, having thoughts, creating content, sharing, and also making it visible.
Mhm.
So that was a lot of effort, because it needs to be ongoing continuously, and you need to keep on growing that. It doesn't happen from one day to the other. So it's a it's an effort, really. And also, for me personally, I feel like I'm so involved in what I do and my day-to-days and my activities, that I lose sight of what's interesting to share and what's not. So I had to discover that myself as well, like what's worth sharing, what's worth explaining, and making it more, what needs to be more detailed, what needs to put some explanation, what's obvious. So that's try and error.
Mhm.
There are no instruction manual for that. uh,
Yeah, no, that's great. I love that process because I feel like I've done content for a long time, and it's like it's not easy because everyone says, and I share with different people that are in between jobs right now, totally capable. And we're seeing that right now in the US. You know, there's a lot of these big techs that's laid off, a lot of digital health that have been in the, I call it the, like a train track that's gone wrong. You know, you got Series A to IPO, and when you got evaluations that have been reevaluated, things aren't. It's got to run upwards and outward and get some IPOs and exits to get the. So we're in a weird point right now, and it's hard. And so, you know, having these conversations offline, it's like you got to do something to get yourself out there, and sort of that was the thing that I enjoyed doing this podcast. I feel like it's scratching the itch, but then it's like, what's the frequency? How often? What do you talk about? And then, like, you know, how often do you post? Like, if you're doing a newsletter, do you know, do a big letter once a month, or do you do mini letters? It's like, you're totally right. And then it's like, relevant. Are people going to think you're quacky or wacky? And it's that and I think I loved the way you kind of shared your mindset, that a little bit of that concern, that fear, because you don't want to crush a reputation while you're trying to build a reputation, your credibility, especially with an MD, your doctor. So this is something that everyone should have to be going through, because you have to. And now we're getting this, like, everyone and their mother and sister and brothers having a podcast, you know, and it's just like there's a lot of dilution. So do you want to share a little more about that? I feel like that is so important, that it's like what you're sharing, your own personal brand, your own diving deep, because that essentially is what allowed you to get that job. You had your point of view, you had your opinion, you gained confidence, you were able to share how you are different and why you versus someone else. I mean, so tell us about that.
Well, yeah, coming from a medical discipline, my own field, my own network was filled with people showing their newest achievements, or their, I don't know, the last courses they took, the last certifications they took. And someone told me that that was very nice, and it's someone that it is something that you need to have to do your job, but no one needs to know that you did that in order to be appreciated. And it would be like the equivalent to broadcast that you have a driver's license when you're driving your car. It's not necessary to broadcast that, but if you need to have it to be able to do it. So that was like the first piece of advice I guess I took, and I realized that it's not necessarily constructive to show all the certifications and courses that I took, but what I learned from that, and that's much more valuable for other people. So that was one of the earliest pieces of knowledge that I was able to apply into my own personal page. But then also I discovered that, well, a couple of things. For instance, some personal stories that I shared on LinkedIn, that I didn't expect them to be anything in particular, ended up being the most viewed, shared, commented stories in my profile. I don't know why. I wasn't able to predict that. So I'm always surprising myself with what's the good piece of information that I will share. And then creating original content goes goes a long way further than resharing or using someone else's.
Mm-hmm.
So that's why I encourage myself to write and think about the content that I need to express. And then I think that what you were saying, having a continuity. I'm not very strict with the periodicity. I don't do, I don't know, weekly posts or podcasts or newsletters, but I try to have an ongoing feed and content. Sometimes it's harder than some others.
Mhm.
And then having a growing network, I think that helps a lot, specifically when you're in niche. For example, combining healthcare with technology or pediatrics with informatics. And those are very specific areas of expertise. So knowing the pioneers or the reference in those areas is very important also. I don't know. I think
Yeah, no, that was cool. I think because of what you've done, I mean, obviously that's how I found you, right? I mean, it's like the reality is, and I'm trying to get away from using LinkedIn. I want to find other ways to find good people and good guests. But I would say, yeah, just what you validating what you were putting out there, getting your message out there. I was like, man, this is pretty cool. I want to have her on. And so totally, absolutely. But now I also, don't want to just be stuck in that LinkedIn. It's sort of like the algorithms. I think it's changing. It's good and bad. Obviously, it's a great platform. One of the best right now, still for professionals. But tell me what you see yourself doing in 7 years. Dream with me. Like, would you like to be an LP of it? Would you want to have your own company? Would you want to have multiple companies? Do you want to travel somewhere else and do something? I mean, if it, put yourself out there. And of course, this is just dreaming. No one knows. Who knows? But just 7 years from now.
well, I think that from it took me so long to get here that I'm really enjoying the moment. It was my wish from 7 years in the past was to be where I'm now. So now I'm really happy with my situation in professionally, my job, my living situation. But I think that traveling is something that motivates me, and I'd like to experience that, being able to work remotely or having work related travels, or just being a digital nomad. I don't really know in what way, but I I see myself traveling a lot these next few years. Also, I well, that has to do with the living situation. I also found that in the last few years, I was very meticulously or very conscious about my work-life balance, and I'm now able to adjust that very well. Sometimes I need to, I don't know, work late, but I compensate that with taking a long lunch, or I don't know. I feel like I can manage my own time, and I like that very much. It helps mentally and physically. And in 7 years, uh, well, I expect the company that I'm working for right now, Adira Health, to grow. And I would like to have like a more a bigger company with a very clinical oriented area, and I'd like to be in that area. So that's I think what I see in the near future for the job
Yeah,
field.
no, you're very wise. So that's you answered that question in a great way. I think you could be a politician too. Who knows, aspiring politician. Tell me about some communities. You mentioned LinkedIn. Are there any specific communities that you'd like to say, regardless whether if it's in Spain or Madrid, where it's in person or remote? And then mentors. I would love to know if, I mean, it seems like if you want to be successful, those are the two big things that you need to surround yourself by people that are.
Well, yeah, for me, the community. LinkedIn was a very good enabler, or I don't know, viralizer in that area. But I think that being taking part into health tech events or specific oriented type of networking that are very related to one's own field, that's very important. So it's been like 5 years since I exchanged career paths, and I started to go every event that I found on the topic. And well, I began in Argentina, and there weren't many, so we were very few people, and we got to know each other very soon. So that was very helpful because I was in touch with the main references in the field. Um, and that allowed me to know some other references globally, which was also an advantage when moving from one country to another. And then mentors, well, yeah, in my own field, I feel like the career is very young. For instance, in Spain, it's not even a medical specialty yet. So the mentors are the ones that you find along the way and already went through the things that you are going through. So I have some mentors from the Argentine Society of Pediatrics, where I'm a member, and I have some mentors from the Italian hospital in Buenos Aires. That's also where I specialize in health informatics, and also some mentors now here in Adira. I feel like they're showing the way for these next few years.
Awesome. So how about like, so are there any health tech, any events that remote or in person that are housed in Europe or Spain that you found helpful or want to go to?
Well, yeah, there are many that usually what goes in United States also has an European version. For instance, there's HIMSS, AMIA, or MIE, which are the three more medical informatics oriented. But then there's a lot of events more focused on startups in health tech, such as Health, MedTech World, and South Summit was in Madrid recently. I feel like there's a lot of energy in events for startups. So there's a lot going on there, and I'm always looking for for events in health tech specifically. Um,
And do you attend those? Try to attend those for your company? Are there some that you've gone to or will be going to in Europe?
well, I have gone to many last year before I was working with Athira, and I was in between countries.
Mhm.
And now for this year, I'd like to go to some. I'm not going to all of them, but I will try to be at least
Yeah.
at, at the most.
And is that both in Europe and in US, or is there one or two that come to mind?
Well, yeah, in June there's going to be the health in Europe. It was in United States. I think there was in April or March. And then there's MIE in August here in Europe. There's AMIA in United States. Then, also HIMSS is going, but I think it's next year. Then there's the events of the American Association of Pediatrics that's going, I think, in September. And since I'm a pediatrician, I'm also interested in attending that. Um, yeah, those are the next ones, I think.
Cool. Because I mean, I find that the conferences, there's never a shortness of conferences, and it's just the size,
Mm.
scope. It's just, I mean, it's some of the people that I've connected with, I follow. I mean, and I mean, I'm seeing some people go into, I mean, some of them, it's possible that they go to 50 some conferences a year. And, that's on extreme, but there's just different, um, and I think from my point is I'm interested in so many different things and many ways a generalist that I find it difficult to know which ones. There are some good ones that I will be going to, um, but it's gosh, that's a business in itself. Like these software companies that help you select, like which one software will you for automation or whatever CRMs. It seems like um,
Well, yeah, it also depends on your own objective with each event. If it's just for network, if you want to sell services, if you want to sell products, if you want to get providers, if you want to invest, if you want to get funding. So I think that you need to
yeah,
have a very clear objective on what you're looking for, and then the decision will
yeah,
become more evident.
yeah,
Also, there's the geographical effect. You can be everywhere at
mhm,
once, and there are some conferences that are more accessible than others,
mhm,
both in
yeah,
terms of, I don't know, geographical area, but also economically
yeah.
wise. Mm.
No, you're totally right. There's so many things. It depends on what your purpose is. And then, some people like are speakers, so that's their focus. And so if they're able to secure a speaker or keynote, those three conferences might be the ones that they attend. And and whether you are an exhibitor, you're absolutely right. Well, Joya, we have a few more minutes. We've talked a good bit. I'd love to send this off soon, but really let you hit it out of the park or whatever you want to call it. Can you help us land this place to Mars or whatever? Tell us a little more how people can find you. Kind of if there's any takeaway that you'd like to share that you were thinking about as we talked.
Well, you can find me on LinkedIn, or, well, I guess when we share this, we'll have my at um, everywhere, and I'm very reachable. It's not very hard to get in touch with me. I don't know. I think it was a very interesting talk. We were able to cover a lot of main points on digital nomads, exchanging career paths, a little bit of what I'm doing right now, which it was it was a process of reaching here today.
Mhm.
So I think that's mainly it.
Cool. Well, thank you so much for having me, or coming on, joining us. Geez, what am I'm thinking? So anyway, still need another cup of coffee, I guess. You're already finished with your day, but I think the power we've already said with remote, the fact that
Mhm.
I've never met you in person, you're in one of the best places in the world. Gosh, your museums are incredible. Madrid. I'm in Virginia, where I don't know, let's say 4 or 5 thousand miles away, across seas, and you're here today. What I would like, if I will post your information on the newsletter soon. If there's anything that you think is relevant that would be helpful to make this a better, for others, please feel free to put that up as well.
Yes, of course.
And this has been great. Really appreciate you coming on.